Hi everyone, let's start lecture 8, which is about keeping an eye on healthcare costs. This lecture will be presented in two parts, and this is the first part. This lecture is based on the D2 Hawkeye case study, and in this case study, we'll see how the card and clustering method can be applied to predict the healthcare costs. But I'm gonna present just the card method in lecture 8 in this lecture, and then the clustering will be presented in a separate lecture, actually in lecture 9. Okay, so let's start. On the course map, we are still in the category of card and random forest methods. In lecture 7, we saw how the card and random forest method can be applied to forecast the Supreme Court decisions. And in this lecture 8, we are going to apply the card method to predict the healthcare costs. Okay. Let's have a background on D2 Hawkeye. D2 Hawkeye was founded by Chris Kreider, Doctor of Medicine and MBA in 2001. Uh, the main goal of the D2 Hawkeye was combining the medical management tools like databases that we have in the healthcare systems with analytics to improve the quality and the cost management in healthcare. Okay, and the D2 Hawkeye was located in Massachusetts, USA, and it grew very fast and then was sold to Versec Health in 2009. So the vision of the D2 Hawkeye, um, the vision of the D2 Hawkeye was detecting the cases with usually lower quality and higher cost in healthcare, and then intervening in those cases in order to improve the situation. Okay, so by doing that, they can make sure that the future costs can decrease and the medical outcomes of patients can be improved significantly. Okay, so we all know that with millions of lives being monitored every month, then the manual detection of individuals would be actually infeasible, right? So here we need to apply the analytics approach in order to be able to detect the cases that need intervention. Okay. And we can say at the end that the advantage of using analytics here would be the improving healthcare as well as opportunities for discovering new medical knowledge. Okay. In D2 Hawkeye case, we have different data sources like the claims, records, drugs, and so on. So here we need first to aggregate data from different sources, and then we need to clean the data and then normalize and unify the data. And then by having a clean and unified data at the end, we need to secure our database. And then after that, we are able to apply predictive models. So by predictive models, we can predict the healthcare cost, and then based on that, reports will be generated. So as you see here, we have data from several thousand employers with millions of individuals, and data from different sources like the hospitals or other care providers could be in different format or often with missing items and errors. So aggregating and cleaning and normalizing or unifying the data is a very challenging task here. In the D2 Hawkeye case, in that time, they hired over 500 engineers in Nepal in order to accomplish this task, just aggregating, cleaning, and unifying the dataset. Okay. In healthcare case management, we need to identify the high-risk patients and then we need to work with patients to manage the treatment and associated costs, and if needed, we will arrange the specialist care. So this is called the mechanism or the process of healthcare case management. Okay, so D2 Hawkeye tries to improve this process by using by using analytics. Okay, so based on this definition, we can say the main goal of the D2 Hawkeye is to improve the quality of cost predictions. Okay. The service, or let's say the solution provided by the D2 Hawkeye could be interesting for the case management companies, the benefit consultants, and also the health plans. Okay, so in 2009, about 20 million people analyze monthly through analytic platform. So as you see here, it's a huge process, right? And also over 5,000 employers processed monthly. Wow, it's huge process. Before analytics, the process of investigation was based on human judgment. So in that time, they needed to have a team of MDs, and that team should manually analyze the patient histories, right? So in that case, we know that we have limited data sets, and this process is too costly and inefficient. And so a question arises here that can we use analytics instead? And the answer is yes. In the previous slide, we saw that in the D2 Hawkeye, how many processes we had in a month. And that shows the efficiency, and that shows the power of analytics. Okay. The first thing and the main thing that we need to have in analytics is data, and and we know that the healthcare industry is data rich. Okay, but data may be hard to access. These are the reasons. The data usually in healthcare system is unstructured, right? Like the doctor's notes. And it's unavailable. I mean, hard to get due to differences in technology. So different hospitals, different healthcare providers have different technologies. So it's really challenging to integrate the data from those different sources. Okay, and also in some cases it is inaccessible. I mean, having strong privacy laws around the healthcare data sharing. Okay, so these are the restrictions. So now let's see what is available. The available data sources are these two: claims data and the non-medical data. So claims data are the data submitted by the healthcare providers like the hospitals to third parties like the insurance companies for reimbursement. Okay, so usually the insurance companies have standard form for receiving data, so it's more structured and they are available. So one available source here could be the claims data, and the second available data source is non-medical data like the general demographic information. Okay, so these two are available data set for our study here. Okay, here we have a sample of claims data. So here we have a claim type, and then provider name, diagnosis code, diagnosis description, and then the source of diagnosis code, source of diagnosis description, and procedure NDC code. NDC here stands for National Drug Code. And then procedure NDC description, service date, and paid amount. So any insurance company can have a standard form like this, and all providers should provide data based on this form. So this helps a lot in order to have a unified data set for analysis. Okay. So as you saw in claims data, they are usually rich and structured data source. We have a very high dimension data set here, but one of the disadvantages of claims data is this: we don't have usually all aspects of person's treatment or health. So we need to actually infer many things here by seeing those codes and descriptions. Okay. So now let's see what was the D2 Hawkeye's claims data. The claims data was for about 2.4 million people over a span of 3 years. The observation period was 2001 to 2003. Okay, and the results period was considered as 2003 to 2004. Okay, and so here they consider to include only people with data for at least 10 months. So because of that, they could decrease the number of people from 2.4 million to 400,000 people. Okay. In the claims dataset, in the D2 Hawkeye case, there were a very large set of variables, like 13,000 diagnosis variables, 22,000 procedures variables, and 45,000 prescription drugs. So they decided to aggregate variables in order to have a smaller list of variables. So here, how they aggregated the data. They aggregated 13,000 diagnosis variables to only 217 diagnosis groups, and 22,000 procedures to only 213 procedure groups, and 45,000 prescription drugs to only 189 therapeutic groups. Okay. Another variable in the variables is about the cost profiles. Here we have an example. We have two patients here. Patient one, as you see here, doesn't have a sharp change in the claim cost in the past 12 months. Okay, it's almost constant in the range of $10,000 to $20,000. Here we assume that these numbers are in $1,000. So this behavior would be on a chronic illness case, right? So it's expensive, and we don't have any sharp change in the cost. But for patient 2, as you see here, it's almost zero in the most of the times, but there is a sharp change in month 3. It jumps from $0 to $70,000 just in 1 month, and then we have $30,000 here, and then again it becomes 0. So for these cases, we consider the cost profile of acute cost profile. Okay, acute cost profile, and the example for this could be, for example, childbirth or having surgery. Okay. And here we have additional variables like chronic condition cost indicators, and also 269 medically defined risk rules, like the interactions between the illnesses and the interactions between diagnosis and age, and non-compliance to treatment, and also illness severity. Okay, and the last would be gender and age.